Good afternoon, everybody. Happy new fiscal year. Probably people weren't realizing that it's fiscal year 2026. Those of us who are budget people certainly enjoyed the fireworks 2 nights ago. But the county executive is not able to join us today. He is off this week, getting some time off. In a moment, I'm going to bring in our special guest for the week, Delegate Bonnie Cullison, a longtime friend and colleague who will talk a little bit about changes that have happened at the state, new laws on July 1st, new laws coming up on October 1st. And then we're also going to talk about a few other issues. As someone who has followed budgets, public budgets at the state and local level, and of course the federal government, this past few days has been remarkable, frightening, shocking to watch with the passage of what I think is appropriately called Trump's big, terrible, horrible, not good, very bad bill that will impact all of us, including the state of Maryland, the Montgomery County government. There are so many things that this bill does. So hopeful that maybe a handful of people in the House of Representatives will finally stand up and say no and take a moment to look at this almost 1,000-page monstrosity to figure out what it's going to do. But what we do know is it's an attack on vulnerable residents. With just Medicaid, you're going to see almost $1 trillion in cuts to spending on Medicaid. What does that mean? That means, I think I've seen estimates as high as 17 million people nationwide are going to lose their insurance. That means people being evicted from nursing homes. That means rural hospitals closing. That means an impact to providers here. I'm sure Dr. Bridgers, Mr. O'Donnell, and Dr. Stoddard might have something to say about this and answer questions when we get to that point of the presentation. But the impact on health insurance, the impact on medical providers is going to have consequences that are hard to predict and potentially destabilizing to the healthcare industry. The elimination and reduction in SNAP benefits, Supplemental Nutritional Assistance Program, sometimes referred to as food stamps, cuts to that program, changes to eligibility. As the one county in the state of Maryland that does eligibility determination for Medicaid, Medicare, for SNAP, we are going to have to figure this out. The good news is several of these changes about eligibility determination will not go into effect for 2 or more years, but the end result is going to be fewer people in need receiving food assistance. Another troubling development. This will mean real harm to the county's economic base. We've all been living on this roller coaster of federal employees being fired, rehired, transferred. You've got cuts in this budget to the National Institutes of Health. And while that will impact support for research all over the country, it will also impact the NIH offices that are here in the county. And it will, in fact, impact all of our lives with reduced research into critical improvements in healthcare. It's remarkable the progress that we have made as a nation with the incredible foundational science that's done at NIH, and to see that jeopardized, jettisoned is disappointing. There are cuts to climate and energy programs. I was joking with someone today. I think that the bill requires all of us to switch to coal-burning stoves to heat our homes. I mean, it's fascinating to see the war on solar, the war on wind, on electric vehicles, and of course, hostility to higher education institutions. the damage and support to research programs that are going on at like the University of Maryland, Johns Hopkins, as well as just support for students who are attending higher education at any level. We'll see the implications for that for years to come. We're still trying to understand what this does to federal assistance to state and local governments, the strings that are attached to that assistance. So we are going to be discovering for days, months, years to come the implications of this bill and its impact on our communities. And then, of course, and probably no one on this call can be more articulate on this issue than Dr. Stoddard, long-term damage to pandemic readiness, to our emergency preparedness, the war on FEMA and trying to destroy the efforts of states to prepare for things like hurricanes as we enter, the second month of hurricane season. It'll be fascinating to see what damage is done to states around the country and waterfront communities if there are significant hurricanes or other weather events. So, as we know, this bill doesn't solve problems, it creates problems, many problems. It will force local governments like ours to do less with more, while millions of Americans, our neighbors, our friends, our colleagues, people all over the country will suffer. And of course, we know the tax breaks aren't going to everybody. The tax breaks are geared to people at the highest end. While we're very fortunate that many of those people choose to live in Montgomery County, Maryland, still the impact, the fairness of this is just shocking, which is, causing the state to take action to shore up its finances. It causes the county to take actions to shore up our finances. So things continue to be stable in Montgomery County, but we are going to be watching and dealing with the implications of this bill for many years to come. That doesn't mean good things aren't happening in Annapolis and that during the 2025 General Assembly session, progress wasn't made in Maryland to look out to the most vulnerable, in Maryland to look out for people in need of health care, and in Maryland, people looking to see protect the promise of reproductive health, abortion care, birth control, which is why we're so thrilled to have Delegate Cullison come on and talk about this. Bonnie has spent her career in Montgomery County, working in the Montgomery County Public Schools, being a union leader, and now as a member of the House of Delegates representing District 19, which includes Silver Spring, all the way up to Olney, including Leisure World, Aspen Hill, many great communities in our county. Bonnie serves as the vice chair of the Health and Government Operations Committee. So she has a huge hand in the policy development in Annapolis on healthcare issues and on procurement, government operations. So an interesting mix. But Bonnie, thank you so much for joining us. Thank you for your work each and every day on behalf of the residents of District 19, the residents of Montgomery County, the residents of the state of Maryland. So I'll turn it over to you to talk a little bit about, both the implications of what's coming out of Washington, but the new laws that went into effect just yesterday in the state of Maryland, and a preview of some of the changes that will be coming up on October 1st, as many of the law changes go into effect on October 1st.
Yeah. Thank you very much, Rich. Thanks for that introduction and for inviting me today. I have now served in the House of Delegates for 15 years, and I have to say this session was the most intense session that I've experienced, and really for two reasons. One, we were dealing with our own budget issues, making sure that we had the funds that we need to for the programs that we have identified and believe are being successful, and two, for trying to understand and live in a world where our federal funding is totally uncertain. And so, as you noted, there are basically two times when bills are we go into practice, and July 1st is one, October 2nd is the second date. So the bills that we see come in on July 1 are ones that are generally bills that can be done fairly quickly without a lot of building infrastructure in order to implement. And so one of the bills that is very important is the creation of the Office of Disability Employment Advancement. We established that office, and that office is charged with allowing or identifying ways to really enable our folks with disabilities who are capable of working, and many of them are, finding ways to help them gain employment and live full lives, because that's really what it's about. They're not asking to be, subsidized by public funds. They're asking to be active community members. So this office is charged with making sure that they have those opportunities. We also extended the Young Adult Subsidy Program. What we have done over the last few years since the Affordable Care Act came into being and implementation is trying to get everyone covered in Maryland. We are now at 94%. Now, I am very, very nervous about what I call it the big, bad, ugly bill, the impact it's going to have on that number. But right now, as of today, 94% of Marylanders are covered by some kind of insurance plan. And one of the ways we accomplish this is by making insurance affordable for young adults. And that includes adults from 26 to 34 if they were on their parents' plan before, up to 26. But if they're emancipated, anytime between 18 and 34. And this is a state subsidized program on our Maryland Health Benefit Exchange that allows for young adults who have income based on their income levels, pay very low insurance rates. In fact, the average rate for this population is about $35 a month. And for full insurance coverage, that's what they pay. The state is subsidizing them through the exchange in order to be covered. Anyone who understands anything about insurance is you want young, healthy people in your pool to lower the risk, because the cost of insurance is based on the risk of payment out. So we've been very successful. It was a pilot program. It was to expire in December of 25. We have now made it a permanent program. It's been very successful, and we've enrolled a lot of young people into this program. Another issue that we've dealt with over the last few years, and particularly since COVID, is mental health. And we're seeing, we have a real shortage of mental health providers. And we need the infrastructure to make sure that when we have the providers, we are able to deliver the services. So our behavioral health crisis collaborative was established, which essentially sort of helps to secure an infrastructure from the state down into the locals to make sure that there is always an access point for someone who is in crisis. And it's tied to the national 911 line, and it will make sure and requires, as of today, that every local have that contact, every local county have that contact in the process. So another bill that comes into implementation yesterday, but is a part of a much bigger issue, and Rich, you alluded to this, is reproductive rights. The federal government actually passed laws back in 2016 and 2018 that said that pharmacists could deliver on over-the-counter birth control and didn't need a prescription from a doctor. However, that ability has not been taken up by pharmacists, and that limits access to a lot of people. So this bill that we passed this year takes our Maryland Commission for Women and requires them to establish a collaborative, diverse commission that will address this issue and identify ways and work with pharmacies and work with the entities to help make sure that they are that people can have access to this, to over-the-counter birth control pills. But that brings up the bigger issue of reproductive rights. We are very concerned because the piece that's still in the bill, the bill that the big bad bill, is that any state that provides any support for abortion care, or any entity and the state subsidize them, like Planned Parenthood, would not be funded. And so Planned Parenthood would essentially, under this bill, would be defunded across the country. Millions of Marylanders take advantage of Planned Parenthood. Abortion services are just one service that they provide. They provide a whole range of reproductive health for both men and women. It's a real travesty. One of the things that another bill that we passed, but that won't go into effect until until October, and they're building towards this, is the abortion grant. Insurance companies have been collecting money over since 2017, since the ACA wasn't implemented. That was for abortion services only, but they haven't spent it all. In fact, they've spent a very small percentage of it. And that money is completely separate and segregated and can be used for nothing else. The bill that we passed this year will allow us to tap into that fund and be able to make sure that our reproductive health care providers in Maryland, and particularly around, if they can only be used for abortion care services, but we will be able to provide the funding that they need to be sustained. So those are just a few of the things that we did. There are a number of bills that we passed that are putting Maryland in a position where we can respond timely to any changes at the federal level, including requiring that all commercial carriers in Maryland continue all of the aspects of the ACA, that include all preventive services, coverage for children to 26, no lifetime caps. All of those factors have to continue going forward. And so we've created, and we have also created a commission to look at the impact of the federal law that will help us to figure out how we can continue to cover people in Maryland with insurance. So those are some big bills to look forward to in October. But right now what's happening is a lot of work's being done to prepare for them. So those are a few things. There were 1,800 bills discussed in the House this year. About 900 of them passed. HGO passed about 200 of them. So there were a lot of health and government operations bills passed. So, Rich, I'll turn it over for questions.
Thank you, Delegate Cullison. There are many interesting issues, I know, for several reporters who are on here to follow up on. I mean, even if you don't have questions today, there are some really big issues that I think the community would want to know about, especially around reproductive health care, the things that Bonnie was talking about, and where Maryland truly is a leader in trying to protect access for everyone. When other states and communities are going the exact opposite direction. I do want to pause and ask you about the prescription drug affordability efforts, and if there's anything you want to say about that.
How long do we have, Rich?
Yes.
Basically, we passed a bill in 2021 that created the Prescription Drug Affordability Board, which was charged with looking at affordability of the prescription drugs for state and local employees only. And the board, it took it a while to get set up because the previous governor didn't appoint all the people who needed to be appointed in a timely way. He vetoed the bill originally. We had to wait a year to override the veto. But really, this is about containing the cost of pharmaceuticals in Maryland. The board is now up and running. it is now in the process of considering the first two drugs for affordability challenges. Those are Jardiance and Farxiga. Seen them in many, many commercials. I will tell you that pharma spends more on making those commercials than they do on research and development, and they won't deny that. So just understand where this money is going for these drugs. And the board is able to look at a number of options that would decrease the cost to Maryland for the state and local employees. What the bill did this year was expand that to our commercial carriers. So if we determine an option such as an upper payment limit, and an upper payment limit is not a price cap. An upper payment limit is it's a negotiation with the manufacturer that says, I have 1 million people in Maryland taking your drug. So if you want to deal in Maryland, this is how much we can pay. We can't pay anymore. It just works like everyone's household budget. This is all we can pay. All of our research says, this is how much it costs to make the drug. This is how much to dispense it, and this is how much we can pay with some, allowance for some profit. And because we were the first in the nation to establish this board, there are now 8 states that are looking at it. 2 states that have actually established this kind of board. We're the first that are moving into the commercial market. And what that will mean is that if an upper payment limit is determined, then the commercial carriers that's the amount they would pay as well as the state and local governments. So while consumers won't see it at the point of sale at the pharmacy, what they should see is a difference in their premium. Right now, every premium dollar, 33% of it goes to prescription drugs. So if we can, just 10 years ago, that was 17%.
Wow.
So it's doubled in a decade. And premiums should start going down when we begin to control the amount of cost that we have in the state in a way that is attentive to the needs of citizens. It's not about making people take cheaper drugs. It's about us being able to pay less for those very expensive drugs.
Yeah. Well, it's funny when you mentioned the advertising for Jardiance and Farxiga. As soon as you said it, I was like, the jingles come to mind. So one other thing that I want to point out to everyone on the call, the General Assembly has created a Joint Federal Action Oversight Committee. It's co-chaired by the Speaker of the House, Delegate Adrian Jones, the President of the State Senate, Senator Bill Ferguson, to look at the impact of federal law changes on the state of Maryland. They had their first meeting last week on June 25th. All of that information is available online. The presentations that were made, I'm saying this to the reporters, not lecturing Delegate Cullison, but there's a very interesting PowerPoint presentation by the Governor's Office of Federal Relations, 36 slides that explain the concerns that the Moore administration have with Trump's terrible, horrible, not good, very bad big bill, and as well as the analysis by the nonpartisan staff agency to the General Assembly, the Department of Legislative Services. Archived on YouTube, of course, is the verbal testimony that Attorney General Anthony Brown gave to the committee. So reporters who are interested may have missed this hearing in Annapolis. That is all available to you on the General Assembly website under the Joint Federal Action Oversight Committee. From a Montgomery County perspective, Senator Feldman, Senator King, Senator Smith, Senator Wallstreicher, as well as Delegates Corman and Moon are all members of this committee. For people who are looking for any of the reporters looking from a Montgomery County perspective on those members. So with that, I see we've got some hands up. So Judith, you were first.
Okay, thanks, Rich. Hi, Bonnie. Hi. Just wondering, I know you just gave the numbers of the sheer volume of bills that, came through and those that were passed, but can you narrow it down to say one or two or three that you were really hoping were passed this session and or that you're hoping will come back again in the next session, that either you will bring forth or that others will bring that you're hoping will get another trip through?
It's hard to limit it to one or two, but one that I would love to see us have more discussions about and hopefully look at more seriously are what we call outpatient treatment centers for folks who are drug involved. And this has been a program that's been very successful in New York. And it's a place where people can go to get to be in a clean environment to use their illegal drugs essentially, but it also provides the ability for them to talk to people, to social workers. They can find access to jobs through this setting. And it's been in New York for a number of years. They're working on it in Connecticut now, but they've seen it's a significant difference in the number of people who are dying of overdoses, who are using those centers, and they are seeing good improvement in folks taking what they learn, being cared for in that setting, and becoming more productive citizens and sometimes beating their habits. So that's something I know is near and dear to our heart that we'd really like to see. That's the one that comes to my mind. I'd like for us to do, this isn't in health and government operations, but I'd really like for us to be looking for ways to really even move more forward in our environmental issues, because the things that we were looking for, we've made wonderful progress on it, but a lot of it is, hampered by some barriers relative to other states around us, and because in the long run, you need cooperation from the surrounding states in order to make a real impact. So that's something I think we'd like to do more of. The whole energy question. While Maryland's made really good progress on solar and wind, there is more to be done there. So I guess I'm worried about the long-term effects of not doing enough now.
Thank you.
Rebecca.
Hi, good afternoon. Nice to meet you both virtually. Rebecca with Channel 7 here. A couple of quick questions on the new laws that have gone into effect as of this month. If we can talk about the Tenant Bill of Rights, can you explain what kind of protections will they have? And are these new protections, or are they protections that they've had all along, but now they're going to be outlined?
Okay. Well, I'm going to be really honest and say that I am not really well versed in bills that are outside of the level of discussion we have in HGO, but I will say that there was a great deal of discussion on that bill on the floor. The concern was that it was burdensome for landlords, but the argument is that tenants need every benefit of the doubt in order to be able to maintain housing. And so these are new requirements for landlords and owners, and we believe that they're doable, and we would, hopefully we'll see less people evicted ultimately than is currently happening.
Thank you for elaborating on that. And if we can talk about, there's over $1 billion statewide in added taxes and fees. Is there concern at this point how that may impact the local economy? We have, for instance, cars are costing more. I don't know if dealerships have reached out to express any concerns, or even just as a whole, how this may impact us here.
One of the things that we did this year was there was a lot of discussion between the governor, the General Assembly, and local leaders on the current budget. And while we recognize there is a hit to local counties, we were convinced, and I think local leaders would have said, this is a non-starter if we can't do it. And everyone was understanding that there had to be give in all areas. And there really is give in all areas. But the programs that are most effective with our most needy people, those were the ones we were trying to protect. And I think folks understood that generally. So lots of discussions. Nobody's saying that there aren't pains in this budget, or in those cuts, but we saw it necessary in order to be able to stay in the programs that are really helping people.
Thank you. And then real quick, just the same question for Rich as well.
I would say on some of the revenue issues, it's very important to note, I think the General Assembly was taking actions to balance with some of the changes that one could see most likely coming out of Congress in the terrible, horrible, not good, very bad big bill. I
mean locally, with the change this year.
Well, none of our major. I mean, we were in the end. The property tax rate stayed the same. The income tax rate stayed the same in Montgomery County. We are fortunate with our stable economic outlook and revenues. So there were some changes that were made to some of the fees that we collect in order to deal with some of the issues that we have as we try to make some smart moves about how we handle recycling and trash pickup in the county. So the overall, while yes, a property tax bill, if the assessments go up, the bill goes up, the rate on property tax, the rate on income tax stayed the same in Montgomery County. Some of the changes that were made at the state level, I think, were to adjust for some of the things that are happening at the federal level. There's a lot of conversation around making car loans tax deductible. So if that's part of, and I think that's in the version of the bill that passed the Senate, well, then luxury cars where people get a tax benefit, then having a slightly higher sales tax on the cars over $50,000 at the state level will help support our transportation program in the state. So balance things out so that we can continue to provide the services that people in the state of Maryland want, because I don't want to spend $100,000 on a car only to have potholes everywhere and damage the car. So
thank you.
Thank you, Rebecca, very much for asking questions. So with that, I don't see any more hands up, so we'll go on to a few other questions. Delegate Cullison, please stay on if you'd like. You can answer questions about fireworks safety later if you want. But again, thank you, Bonnie, for joining us so far, for your comments, your answering your questions, and your leadership each and every day for the people, again, of the state of Maryland and Montgomery County. It's always a pleasure to work with you and see you.
Thank you.
Just want to point out that last Friday, certain changes went on with Ride-On. We are now at 0 fares on Ride-On buses across the county. Please remember that's for Ride-On buses, not for Metro buses. If you're getting on a Metro bus, there is still fare collection. But for Ride-On bus, it's now 0 fares. Probably people saw there are a whole line, a whole range of route changes, all part of our Ride-On Reimagine plan. Everything about that plan can be accessed on our county website, montgomerycountymd.gov/DOT. You can read all about the route changes. The Metro bus made a series of changes. People may have noticed all bus routes in Montgomery County on WMATA now start with the letter M for Montgomery. If you notice, there used to be Q buses, K buses, L buses. Now, every bus route that's in Montgomery County has an M, just like every bus route in Fairfax County has an F. Arlington, Alexandria A, Prince George's P. So when you see those bus routes, you know where the buses are going by the first letter. And downtown, they have buses that have both a D and a C. So it makes it much easier for riders to understand where those buses are going within the metropolitan region. Hey, July 4th is Friday. July 4th means fireworks for many people. They are illegal in Montgomery County, regardless of where they're purchased. Please, even if you purchase a firework somewhere where it's legal, do not use them in Montgomery County. Yes, even sparklers, do not use them. Leave it to the professionals. You have lots of opportunities to enjoy fireworks in and around Montgomery County, but just not in your backyard. I know we had a session yesterday that showed fireworks safety. Don't blow your head off with the fireworks. Go out and enjoy them where they're done by professionals. Fireworks are dangerous. They cause mild to severe injuries every year. They carry the risk of brush fires. Fortunately, we're out of the drought, but still they can set off fires of both homes as well as brush. And certainly people, and you probably can spend time on TikTok or Instagram seeing all sorts of fireworks gone awry. Don't do that here. While their private use is illegal, some entities are allowed to set off fireworks. If you want a list of all the permitted fireworks, you can go to our website for the Department of Permitting Services, where they show it all. So don't be surprised if you don't see fireworks shows. Neighborhood associations got to get a license. Certainly other private clubs around the county will be shooting off fireworks, and the county will have its professionally run fireworks show on July 4th in Germantown Glory at the South Germantown Recreation Park, and of course the Mid-County Sparkles at Einstein High School. So please feel free to come out and enjoy those fireworks both nights. They begin at 9:15 p.m. Again, leave the fireworks to the professionals so we don't have injuries, property damage, fires. Let's all celebrate wisely by following the law and not setting off fireworks in Montgomery County. We want to thank everyone who helped our animal shelter this past week. When the air conditioning failed, we had to ask the community for help, even though we were trying to keep all the pets cool. We had fans. We were able to repair it very quickly. We were able to get lots of people to come out. You can see the image of the people standing in line to be foster parents for the pets. We greatly thank everyone who came out. The response was overwhelming. Many people agreed to care for the dogs and cats. We had to fast track the process to do it. But again, so many people opened their hearts and homes to these animals. So thank you so much for doing it. Again, it's a testament to how compassionate our community is. These actions, quick actions, help save the lives of pets, but ongoing support is needed. If you are interested in adopting an animal, cats, dogs, we have lots of other things at our animal shelter. Please go to montgomerycountymd.gov/animal services. You can see some of the animals that we have available. So, it's been hot. We know it's been hot. Fortunately, maybe we're going to be entering a few days where the temperature is slightly lower and dew point is lower, but it's very important to think about safety when it comes to heat, when it comes to weather, to be aware of flash flooding. We have a new flash flooding sensor system that is able to allow us to more quickly deal with flooding and flooding on roads, which has been a huge help. The state has a new weather monitoring system. The very first weather site went up in Montgomery County at the Trolley Museum. There'll be others, but you can get chock full of data. Dr. Stoddard can tell you all about the type of data that's available, but the Mesonet system that is set up around the state to provide us with a lot more ongoing weather information. So always remember, especially in the heat, even if the extreme heat wave might be over, don't leave a child in a car. Always check the back seat before exiting your car. We ask you again to be smart and don't leave valuables in your car that are visible to people. Take them with you. Put them in the trunk, because what we don't want is people having their cars broken into. So be smart. Stay hydrated. Drink 3 to 4 cups of water every hour when outside. Dr. Bridgers can tell you all of the important things you need to do to stay healthy. Avoid drinks like energy drinks when you're just going to be outside and it's hot. Begin hydration before you feel thirsty. Recognize signs of illness. Symptoms like confusion, nausea, and headaches are all signs of heat stroke. Take breaks. Get some time in the shade. Dress appropriately. No coats and ties if you're sitting outside in the sun. Be aware of factors like humidity, right? The heat index. The temperature might be one thing, but with humidity, and we all know about humidity in the mid-Atlantic, can make it even worse. So, and remember, think about older adults, young children, people working outside, people with disabilities, all people that have heightened risk. Check in your neighborhoods, check in on your neighbors, utilize cooling centers. It's important to stay healthy during the summer. While we might get a few days of relief, heat and humidity, just a fact of life in the Washington region, each and every summer. I want to give a special shout out to some of our public safety workers, firefighters working very hard each and every day. 2 of them were injured in a fire, I believe, yesterday. Fortunately, they're recovering and out of the hospital, but it's a reminder of the great work that is done by our fire and rescue service. People are willing to put their lives on the line for us each and every day. Why we have just an outstanding, if not the best in the nation, fire and rescue service. And of course, our police department. This will be a busy weekend, as always. But a special shout out to the police in the Bethesda district who were able to find 2 children who had been missing for more than 3 years, who are located in Bethesda. They had been from their father lived in Missouri. They had been last seen in Florida, but smart, diligent work by police officers, by colleagues at the Department of Health and Human Services, by staff at Suburban Hospital. We were able to identify these children. One police officer realized something isn't quite right about this three people, an adult with 2 children who appeared to be homeless, but non-communicative with anyone who wanted to interact with them. And here we were able to find that they had been missing for 3 years and reunited with their father. Very good news, good work for the Montgomery County Police Department, the Department of Health and Human Services, the outstanding work of public servants each and every day in Montgomery County. And finally, one thing, because July 4th is a holiday, there'll be no trash recycling collection. Everything will move back one day. So if your normal collection is Friday, it'll be collected on Saturday. So with that, Dr. Bridgers, Dr. Stoddard, anything you would like to add?
Sure. Good afternoon, everyone. Thank you, CAO Madaleno. Just one point to note that the Department of Health and Human Services is here to assist with all of the uncertainty at the federal level with this bill that you so eloquently articulated, that it's not beautiful or big at all. We are here to assist. We have a crises helpline. That number is 240-777-4000. 800-240-777-4000. If you have some concerns or you just don't know about the impacts of this bill, either now or in the future, please reach out to our crises helpline. The Department of Health and Human Services will continue to provide services to individuals and families as we work through this process. We are here to help, and we will be. Having said that, I will turn it over to Dr. Stoddard and Mr. O'Donnell for any updates or comments. Thank you.
Yeah, public health doesn't have any updates. We're just, again, following along with the legislative enactments of the bill. I think our biggest concern right now is the number of U.S. residents and Marylanders who potentially could lose insurance. It's estimated that it could be 17 million Americans that could lose insurance, whether through losing Medicaid benefits or the American Care Act insurance that is enacted in each state. And so in Maryland, that could be almost 300,000 residents. And what that means is even if you haven't lost your insurance, it means hospitals are receiving less payment for services at the emergency department. It means that they have fewer staff. There are longer lines. People show up with more acute illnesses because there's no preventative health. And that impacts every single person in our state, in our country. So we're very concerned with the outcomes of this, and we'll continue to provide services at a local level to try to connect people to insurance and make sure that they can receive these services in Montgomery County.
Yeah, I just want a couple of things that the CAO referenced. With regard to fireworks, as a reminder, for fireworks violations, please do not call 911. You want to make that call to the police non-emergency line. That number is 301-279-8000. We expect that we're going to get a large number of obviously people who did not heed Rich's message with regard to fireworks safety, and other residents who want to report those violations. The police department will make efforts to try to address that, but obviously we will get a lot of calls and frankly do not have enough officers in some cases to respond to every call that we get for fireworks, particularly when they're nondescript locationally. It makes it very difficult for them to track down potentially where the violations might have occurred. But if you want to report them and they will try to respond to them, you want to use the police non-emergency line to do so. With regard to the Maryland Mesonet, obviously it's a tremendous advancement for Montgomery County to get its first station. There are 2 additional stations that are in the works and will be available hopefully over the coming months. The Maryland Mesonet was a program that was actually pitched by Montgomery County Office of Emergency Management to the state of Maryland. The state of Maryland thought it was a great idea, and very pleased with both then Governor Hogan and now Governor Moore. It's a bipartisan program where both have agreed that this is a wonderful addition to the state of Maryland, and you can view the data through the University of Maryland website, who is administering the Mesonet program on behalf of the state, at mesonet.umd.edu. So I'll stop there, and if there's any additional questions about the Mesonet or other things, we can answer them.
And please don't call the crisis center to ask questions about the bill. Call the crisis center if you have needs with your family. While we're on that topic, I want to give a special shout out on behalf of the county executive to our 2 fantastic Maryland U.S. senators, Senator Chris Van Hollen, Senator Angela Alsobrooks, for their leadership on the bill, standing strong, explaining all of the implications to the people of our county, state, and country. So thank you, Senator Van Hollen, Senator Alsobrooks, and of course the continued leadership of our 3 representatives, Representative Jamie Raskin, Representative April McLean Delaney, and Representative Glenn Ivey, who have been fighting in the House, and I'm sure will continue to fight in the House to stop Trump's horrible, terrible, not good, very bad big bill. Rebecca.
Hello again. Thank you for taking some more questions. If we can kind of shift a little
We
bit.
charge you by the question, so feel
Oh,
free to
boy.
keep asking.
All right, I'll get my wallet out. As it relates to looking again at the impact from state laws to potentially the local economy, we have the new tech tax, which is the 3% sales tax on services like cloud storage, data processing. Any idea on how that may impact the local economy?
I know I don't want to throw Delegate Cullison under the bus. I know Delegate Cullison is still on the call if she wants to answer this. That's something that we're obviously following, but I don't have anything to throw out in particular on that front.
And if you can, I guess, just give a broad, are there any laws on the state level that have passed that you think may have a particular impact on Montgomery County taxpayers?
At the state level. So, and by impact, I mean, clearly, there was an increase in the upper bracket for the income tax rate at the state level. The result, I mean, you got to balance it out. Several people at the very high end will pay a little bit more in state taxes, while their federal taxes are going to be reduced greatly. And hopefully people will recognize that in order to keep up the services in Montgomery County. But I just outlined with public safety, fire, police, our school system, our Department of Health and Human Services, the quality of life that we have built in this county and that we protect through our public services each and every day, that commitment is there with these taxes, and that people will want to live in a community where they know, because of police protection, they don't have to spend tens of thousands of dollars putting in alarm systems, gated communities, hiring their own security force to watch out for them, that there's still that collective effort in Montgomery County to protect everybody from our most fortunate to our most vulnerable.
Thank you very much. And then really just finally, I'm curious if any local car dealerships, folks in the auto industry, if they've reached out about concerns with the new taxes and fees as it relates to cars and rental cars, just on the local Montgomery County level, I'm curious.
Sure. I have not heard that. I've not seen that come in through the county executives. Formal communications coming in, so I don't know if people are saying to the executive or council members as they're out and about, but I have not heard that at all.
Okay, and so as far as if that could make a big impact locally, that's not as much of a concern.
No. I've not heard that. I don't want to put in words in the county executive's mouth, but in all the things that we've talked about, that has not come up.
Thank you.
And again, for everyone that, that is a very important revenue source for the state. But in Maryland, unlike the District of Columbia and Virginia, the local governments do not get any direct benefit from automobile taxes, whether that's registration, gas tax, or the titling tax when you buy a new car. Okay, I don't see any other questions. So happy 4th of July to everybody. Enjoy the 4th, but should be remarkably good weather for this area on the 4th of July. Those of you going to the Beyonce concert, enjoy. And fireworks, again, illegal in the state, illegal in Montgomery County, I'm sorry. Stay safe. Don't use them. Enjoy the many, many permitted fireworks shows that are going to be going on, including on July 4th in Germantown and on July 5th at Einstein High School in Wheaton, Kensington. Enjoy your 4th. Thank you to my colleagues for joining us and to the reporters, and especially to Delegate Bonnie Cullison for coming in and sharing her wisdom.
Thank
Thank
you,
you all.
Rich.
Thank you.
Bye-bye.